Hello everyone, this is Shalana Welch presenting a project proposal related to medication adherence amongst the mental health population. I first like to start by giving you a little bit of a background regarding the importance of medication adherence. At current, there are 43.6 million people suffering from some type of mental health illness as is. Of those, as stated by Healthy People 2020, 9.8 million of them suffer a debilitating illness. There are several federal programs that have developed standards related to medication adherence. One program is called the Substance Abuse and Mental Health Services Administration. One policy they developed is termed Population Health Management. The goal of that is to provide current medication lists to all mental health patients. They point out that most mental health patients are really not engaged with mental health treatment, and therefore they need disease management and medication monitoring. The second policy that was established is care management and support. The goal there is for greater than 80% of mental health patients to receive reconciled medication lists, for med education to be done thoroughly, and for barriers to be addressed. I think it would be worthy to state at this time that the number of people suffering mental health is expected to double by the year 2030. There is a multitude of supporting evidence determining the benefits of medication adherence. For this proposal, information was taken from level 1 article, a level 1 article, a level 2 article, and a qualitative review. The summary of all three centered around the benefits of medication adherence, the benefit of patient-provider relationships, and the risk of medication non-adherence. As we pointed out, medication adherence is vital to effective mental health treatment. While that is so, there needs to be a way to determine if the patient is being adherent. So my proposal is use of the Mariski 8-point medication adherence scale. While there is a multitude of tools that were to be selected from, the use of the Mariski scale was selected using the theoretical framework of Paplow's theory of interpersonal relationships. This theory is an interpersonal process. It is centered around two people working for the same goal. It improves the relationship between the patient and the provider, and it also encourages shared decision making. I'll first give you information about the tool, and then we'll discuss implementation. So the tool, as it states, is an 8-point a form that uses 8 questions, which are self-reported answers. The patient reads the questions and then answers yes or no. The tool is generic, eliminating bias or any judgment to be passed. The patient selects their answer, and then once the answers are done, they are totaled using a scale found at the bottom of the form. Scores less than 6 indicate a low chance of adherence. 6 to 7, a moderate chance of adherence, and then greater than 8 indicates a high probability of adherence. The forms are easily accessible and can be repeatedly used as determined. Implementation of the Mariski 8-point scale would first come as a staff meeting between the nurse, the RN, the nurse practitioner, the medication nurse, the physician, and possibly the office manager. The form would be thoroughly presented, questions answered, and then upon agreement of implementing the tool, we would do so. The form is to be used at initial visits and then monthly at follow-up visits, and it is also to be used for simple medication appointments. The form itself does not require a consent to be signed. The patient has the right to refuse, and then once completed, it becomes a part of the patient's chart. Of benefits to using the form is possible caregiver involvement, shared decision making, the patient preferences are assessed, all of which lead to formation of an individualized treatment plan. As I previously stated, the form can be used repeatedly. Use of the form indicates the level of medication adherence using the score at the bottom once the scores are tallied. Initially, use of the form is to be done over 6 months. During those 6 months, of course, the form is used each time the patient comes into the office. It is also 6 months also consist of bi-monthly meetings of the staff members to determine whether or not the form is effective. One more thing I'd like to point out is that this project proposal addresses patients in outpatient mental health clinics. There's no patient selection necessary or required, as all of the patients that present already have a mental health diagnosis. The patients just have to be simply educated on the tool, and like I stated earlier, they do have the right to refuse. That concludes the project proposal presentation on implementation of the Mariski 8-point medication adherence scale. With all of the evidence presented and all of the evidence that exists, hopefully the tool will become part of a permanent part of the process, and maybe even determined to be an evidence-based protocol.